Hi and welcome. I'm trying to learn medicine, today interventional cardiology, and after we've done it, we're going to do medial plane training. And if you participate in the medial plane training, it's at your own risk. Now first wondering, we had here 1 2 times the word dilation. Where did we have it? No, don't use the time to remember what word we're going to have explained, dilation. It was not in the introduction. Okay, then it was here by PCI. Okay, we can't find it at all. Okay, we had 2 similar names, and one of them was vasodilation and the other one was vasoconstriction. Constriction, that's very important. We want to do it when actually it's not enough of it video. Now, we had in biology vasoconstriction and vasodilation. Now, in every human body, and thermoregulation did we have it, and if a human body wants to change the thermoregulation and it is too warm, higher than 37 degrees, then vasodilation is happening. And if a body is too warm, then the person gets redder, the capillaries close to the surface get more redder, and the person sweats, and the whole thing with the vascular system, with more blood pumping, and I didn't end this. This video is about internal anatomy, diseases, and also the blood system. And that whole thing is called vasodilation, was written with bringing more blood to the extremities, to the limbs, and also to the surface, and that makes the person more redder. And that was called vasodilation. The opposite, if the person is too cold and the person shivers, that is then vasoconstriction happening, and less blood is coming to the fingertips, to the lips, the hands get blue, the fingers get blue, and that is called vasoconstriction. Now, in vasoconstriction is pretty simple. The blood supply is constricted and they are getting smaller. And the opposite is now vasodilation. So dialing something means to make it larger. There we have the first word here used here. To dilate an artery means to make it larger. Okay, in interventional cardiology, we had done the PCI part in 3 parts. And basically what that is this angioplasty, which is the dilating of arteries and veins. It makes sense. Yes, an angioplasty is an intervention to dilate either arteries or veins. It is not meant to close. The problem is that there's something stuck or that they're closed for mostly through coronary artery diseases. And I'm saying with that explanation, there's dirt in it. And I think it's called plaque. But how about we just call it dirt? If it's not called plaque or dirt, it is like dirt. Okay, I think it's called plaque, but we haven't written it here, so I don't know really. Now, and the PCI is I don't really get it what it means. It is the bringing in of a deflated balloon through a radial artery, femoral artery, and then to expanding it through the obstructed or occluded. I think obstructed, occluded is the same, just that one means obstructed means maybe that there's something blocked through a thrombosis, through a thrombo. And occluded means that it has closed, but it has the same result, basically. Maybe a different treatment, but it's basically the same, there's no blood flow. Yes, and then it's widened, and then a stent can be put in to keep it open. But I don't really get the difference between stenting and catheterization. Now, what is the difference between a catheter and a stent? And so that's basically PCI. And now the next thing, we had it already. It's from valve, so it's valvoplasty. And that is the dilation of narrowed cardiac valves, the mitral, the aortic, or pulmonary valves. I forgot on that side, the tricuspid and the mitral valves. I showed it in the interventional part. Okay, so it's the wrong place to say it. I don't remember that the mitral and the tricuspid part on that side. But the human heart has multiple valves. It's I don't know the 4 main, but there was the eustachian valve, and if it's not closed, then there is this septal defect. Maybe we come to that in the next part. Yes, we have it in the next part. So basically, the valves the blood should not just go out into the aorta and there's an aortic valve and it closes, and the blood should not just come from the right atrium and the left atrium and there's no one of the two valves in between and they open it only if it is pressed out and then closing them again. They are like the thing of ships. So if something presses against it, if the heart contracts, then the blood comes out, and if the heart releases again, the myocardium, then it just closes again, and the blood does not flow back. That's all. And there are a couple of valves, and these valves are doing a lot of work, and they are pretty small, and it's just a piece of flesh, basically. No, and there can be something wrong. What is it? My whole life hates such a little thing. I don't know, but to realize it just... We have these 5, 6, 7, 8 valves, and all have 2 of them on both sides. And I don't know how big they are, but they can't be much bigger than half a centimeter. And this little fleshy thing is keeping people from dying. Okay, the next thing, congenital heart defect correction, we're having it here basically. Percutaneous approaches can be employed to correct arterial, septal and ventricular septal defects, closure of a patent ductus arteriosus and angioplasty of the great vessels. Okay, this percutaneous approach, this PCI approach, I don't really get what it is. That section is just way too long. I don't know what is it now. In one sentence, is it the injection of a deflated balloon and inflating and then keeping it open? Whatever. Now, the atrial septum, so the atrium has also a septum between it. Does it, or is that a problem if it has a septum? No, it has a septum. It is the atrial septum defect if it is a problem. Wherefore is it even used? Whatever, there's the heart is 4 chambers, the atriums at the top and the ventriculars at the bottom, and there's the atrial septum and the ventricular septum through them, the blood should go through them. Yes, the one brings to the body, the other to the one comes from the body, then comes to the lungs, and then from the lungs and in the lungs, so there has to be also away from them. And they don't work properly, and that is when corrected in the congenital heart defect correction in the interventional cardiology, and with congenital, these are the ones which are from birth, and also closure of a patent ductus arteriosus. No, I don't know where it is. But the other word which we have to look for open eyes is patent. I think patent. Now, what means patent? I thought that was mean. But it's. I don't want to say the wrong terms. So we have to look for dilating. Dilating seems to make larger. Obstructed seems to mean something stuck, and occluded means closed. And we now have to look for patent. I think it means open. And for the other 2-3 terms, then you're going to do a presentation about it and say it very clearly. Maybe you're going to do something which makes it impossible to confuse these two. But I don't think it happens. It's actually pretty easy and so news. And angioplasty of the great vessels. Now my voice is giving up. This was the part of now medicine to interventional cardiology. In the next part, we will continue with learning about just what is interventional cardiology. We will do now. What are we doing? The medial plane training. If you here for medicine, interventional cardiology, go directly to the next part. We will do the median plane training. It's the median. It's the median for the body, not the median. It's the median. It's the median plane training. If you participate in the median plane training, that is the honors. We are warming a little up. We're bringing the leg up. We're doing the gradient mushroom. We're bringing the foot up and down, down, and the other leg up. And we're bringing the foot up and down, up and down. I forgot to say, but it's obvious that we're just learning, not. But you don't should take medical advice from that, or lecture material or information in any way form. Maybe in the WhatsApp form. That's all it's real risk. We're just learning. We don't know what it is. We don't understand it yet. The next exercise will be bringing one leg up. Yes, we're bringing it up into the right angle, the flexed foot, even the hips, taller than the back. We're breathing in, and we're breathing out. We're bringing the leg to the side. Breathing in. And breathe out the leg back into the middle and down. That is spine pull curl exercise. Leg up, breathe in, and breathe out the leg to the side. Breathe in, out into the middle, down. Other leg up, breathe in, out to the side. Breathe in, out into the middle and down. And the other leg up, breathe in. Out to the side. Breathe in. Out into the middle. And down. And it was not medial plank. Medial plank. It is medial plank really. Leg up and we're pressing over the top against the knee. Lighting up with the leg, flex foot, even line tips, taller for the back, little bend in the elbow. Now we're pressing from the inside. Now the knee presses up and to the side, up to the side. A few more. And the other leg. The leg up. Lighting of the leg flex foot, even line tips, taller for the back, and we're pressing from the inside against the knee. And we press over the top first. And now when you press this to the side. And last exercise, the heavy swing low. Leg up, right angle of the leg, flex foot, even tips taller for the back, and we're pressing the outside against the knee with a little bend in the elbow. And we're opening slowly the leg. And we're closing again. And we're opening again. And the last time. And closing. And now we leg up. And we're pressing from the outside against the knee. And we're opening slowly. Opening. Closing. And the last time. And closing. And down. And we're doing the last exercise, the breathing in and down. Out. In and out. Out. And we cross the legs. And out. That was medial plane training. I thank you very much, and until next time.